Welcome to Fuller Butz, a behind-the-scenes plastic surgery podcast. Yes, you heard that right. Join your co-hosts, Dr. Sam Fuller and Dr. Dan Butz, board-certified plastic and reconstructive surgeons, on an exclusive full-access pass into the world of plastic surgery. Combining their expertise and training, Doctors Fuller and Butz will share medical insights, detailed explanations, and lighthearted humor to keep you entertained and informed. We're certain you'll become passionate about the plastic surgery specialty, and between debunking myths, uncovering truths, or just making you laugh out loud at their perspective on this creative and artistic field, we've got something for everyone. From tummy tucks to Botox and mommy makeovers to surgery do-overs, the Fuller Butz podcast will surely satisfy your podcast fix. All right, now let's dive into this episode.
Hello, everyone, and welcome back to Fuller Butz, a behind-the-scenes look at plastic surgery. I'm one of your co-hosts, Dr. Sam Fuller, and with me here is
Dr. Daniel Butz. Welcome back. Good to be back.
We're excited this week to talk to you guys about tummy tucks, drainless, painless, and removal.
Yes, I love tummy tucks. One of my favorite surgeries. Never say painless, though. Less painful than they used to be.
That's why I left the pause, because I wanted to see what you're going to say.
My body twitch.
So, there's been really a growth in tummy tuck and just body contouring in general. I think just with skinny shots of Ozempic, patients now have multiple different roadways and paths to their weight loss that's safe and that's lasting. And so before, years ago, when patients were coming in for a tummy tuck, if they weren't a good candidate, would say, hey, you have to lose more weight to decrease the risks of infection, of wound healing, of problematic scarring and that sort of thing. But I was leaving them really unarmed and going about their way. Maybe they would get a gastric bypass. And now, if you go to any strip mall or any place else, there seems to be some sort of weight loss center someplace that is offering patients an opportunity to lose weight.
Do you have a BMI limit?
I do. So my BMI limit is roughly 32. Which I would say some of the other plastic surgeons that I've surveyed, maybe as high as 35. But I really want to see patients stable at their goal weight or close within 10 to 15 pounds of that weight. And with the BMI less than 32, to me, I feel is a safe undertaking to undergo. What about you?
Yeah, I'm kind of right there. I used to do 35 and see a lot of patients as we're not good candidates, need to lose more weight. 32, still some, could benefit for losing more weight, but still often see very safe candidates.
Who else would you say is not a good candidate? Is there any other physical anatomy problems?
A lot of it's where they carry the weight, right? I mean, if it's all that visceral fat, that can really limit how flat you can get the muscle repair. So if it's really a lot of loose skin, muscle flat, but they kind of carry it more in the legs, it's less of an impact on the tummy tuck results. So there are a lot of variables. Even at 32 isn't the perfect number. 28, 26 probably better for a lot of patients, but you still get really nice results at 32 and safe. Again, a lot of it's safety, right?
Yeah. And so we were tossing around the term tummy tuck, but what is a tummy tuck? Like when somebody walks in and say want a tummy tuck, what are you telling them that is?
Yes, I mean, the main goal is to remove a lot of that loose lower abdominal skin, typically everything below the belly button to about 6 centimeters, kind of in the mons area. And there's minis, there's normal or fulls, and then extended postoplasties. So there are a lot of different versions of tummy tucks, but really trying to enhance or improve the abdominal contours with skin removal, fat removal, and muscle repair.
Yeah, so I tell them that it's a 3-step surgery. We get liposuction, typically of the flanks, some of the lateral central abdomen. It's a dissection up where we can evaluate and repair their muscles, oftentimes with weight gain and loss, with pregnancies, C-sections, that muscle repair is almost as important as the redundancy of the skin in certain select patients. And then lastly, I tell them that we sit them up, and then that fanny pack of loose skin that everybody seemingly has and nobody wants is then removed. and
Fanny pack the skin. That's good.
Yeah, the fanny pack, it just makes sense. And take that fanny pack away, and then we close it up. We jokingly said, as far as it being painless, I use Exparel, which is a long-acting numbing medicine that's injected into the abdominal wall to really reduce pain afterwards, which has been a game changer. What are some steps that you take to decrease pain for your patients, or what do you tell them they should expect from pain after a tummy tuck?
Yeah, I mean, the Exparel is a game changer. We use the ultrasound guided, tap locks or transverse abdominal plane tap locks, which really is the nerve block agent in the right area. But even with that, it doesn't capture the entire area we're working on. So I tell most patients are probably going to be on some sort of narcotic for anywhere between 2 and maybe 4 days. I've had plenty of patients who come in and just take one of those. They're probably more of the exception than the rule, though. What about yourself?
Yeah, I mean, my goal is for my patients to be on over-the-counter pain meds within 2 to 3 days. And so say, now is not the time to be a hero, but with the numbing medicine that's in the liposuction fluid, that's the Exparel that's injected, with the way that you handle tissues, and with their compression garments and binders, taking some pain meds for the 24 hours or so is expected, but Tylenol and ibuprofen, I think, work great. They're wonderful for this type of pain, and they last longer than what the narcotic pain meds are given. And I would say that there's a large percent that when I'm calling them on the next day, checking in on them, they're saying, hey, I'm feeling really good. And I may have had that was a 6-hour case because we did a breast reduction at the same time, and I feel like my back is hurting or I'm complaining more than the patient is. So that's really what the goal is, but everyone's pain threshold is different. You try to set the expectations. I try to get them started on a stool softener early to combat constipation, give them some tips and tricks as far as holding a pillow for coughing, maintaining a binder or compression garments. But yeah, I do not guarantee painless tummy tucks. That is not a thing, but we want to make it comfortable. And I do think that just the excitement of looking down and knowing that they did something for themselves, that they're looking down and seeing that fanny pack is gone, I think it helps for pain control. They just get more excited. I think it's way different than if you were having a surgery for something else, something that was wrong with their bodies. It's something where they feel good, they're excited, and usually they're out of our surgery center an hour or two later and home resting and feeling great.
Yep. Yeah. It's a pretty dramatic surgery in terms of results. I mean, I always show patients a lot of photos before and during the consultation process to give them an idea what they can expect. And in terms of transformation, those are probably some of the biggest ones that we can really achieve.
Dr. Butz, when will I achieve my final result after my tummy tuck?
Very good question. I tell patients that normally things look pretty good in terms of you can go, wear a swimsuit, bikini, ideally, if you want to, probably as early as, maybe 8 weeks, still very swollen, but looking pretty good. Final results will probably are in the 6 to 9, maybe even up to 12 months, with subtle stuff. Scar maturation probably takes a full 2 years. But it's all pretty slow, kind of stepwise process. The first 6 to 8 weeks is the bulk of it.
Yeah, I think biologically our bodies are healing early on. It's like running a marathon. There's extra swelling, there's inflammatory cells that are there, they're swollen, they're puffy. We know biologically it takes 3 to 8 weeks for that initial period of healing to go down. Starting at 8 weeks is a remodeling phase that can last 6 to 8 months. So I usually tell patients it's 6 to 8 months until you're getting close to that finished product. It'll plateau and improve up to the 1 year mark, and then scars will continue to fade away over time. But I think it's a combination of their bodies healing, but also them getting back into their normal routine. I mean, some of our patients are active, they work out, they diet, exercise, do all these things, and for 6 weeks I'm telling them that they can't do all of those things, that they're limited with no lifting over 10 pounds. Short walks are okay, leisurely up to 2 miles, but really don't want them to be overactive and shocking their bodies while they're healing. So I do feel like that takes some time to kind of get back to their baseline, and so that's part of the delay too, where they may not feel as fit at 8 weeks in a bathing suit, and some of that's for me and some of that's just the body needing to get back to their baseline.
Yeah, for sure.
So Dan, let me just toss this over to you because I was not a believer until you forced me to do it. And
I didn't force you. I just told you how amazing it was.
So for a while, Dr. Butz was just singing praises of his own Drainless tummy tucks that he was doing in Milwaukee. One of the only, if not the only, Drainless tummy tuck surgeon in the Wisconsin state. I initially was reluctant, skeptical, although we had both trained together in Chicago and seen them done, so I knew it was feasible. I was just wanting to make sure that that was the right step for my practice, and then had pushed forward and try.
Did you see them done in training?
Oh yeah.
With who?
Gutowski?
I never worked with them.
Oh,
I never saw one. It was more just talking to colleagues that did them elsewhere and reading up. And the technique is pretty straightforward.
Yeah, two great guys, Dr. Warner and Dr. Gutowski. I think they wrote a paper on it together.
Yeah, they wrote a paper on
it. They used a barb stitch, and so we would do it with an L and starting at the midline and then go across and lateral to that. And so I saw that done. But in speaking with you, you had a slightly different technique that really made sense to me and how I saw and envisioned the Drainless tummy tuck to go. So I jumped on board and I haven't looked back. It's been an amazing, huge boost to my practice. I'm not sure of anyone close to me who does Drainless tummy tucks. And so not only just separating yourself, I don't think it's gimmicky. I think it's real. I think it's safe. It's an amazing.
Would you say your patients have an easier recovery without the drains? I mean, I think that's probably the biggest. I mean, extraral helps, but not having drains is. I mean, that's a huge shift in my. When patients came in at 3 weeks or 2 weeks.
I can say without a doubt that the level of discomfort, pain, irritation, aggravation has gone down without 1 or 2 drains coming out of their belly. It gets tugged down. We get phone calls. It's painful. It's irritated. And then I'm just not seeing, I feel like I'm not seeing as much swelling either afterwards. I feel like their bodies are getting into line quicker with the Drainless technique. And so I know that their eyes light up at the consultation and the pre-op saying, hey, we can probably do this without a drain, or they're being referred from somebody who had a Drainless tummy tuck asking if they can also have a Drainless tummy tuck. So it's an amazing feature of our practices.
Yeah, I think, the data supports this. But the big thing we used drains for was to prevent the risk of seromas or fluid collections. But if you compare those side by side, Drainless actually has a lower risk of the seromas, which I've definitely seen. And if you do run into one, normally they're quite small because of the fact that all these sutures we put in kind of create smaller spaces. And, one aspiration and they're gone. Compared to sometimes you take a drain out at 3 weeks and you have this chronic seroma that's, kind of constantly coming back.
Yeah, I had a patient last week who, asked a great question. She was like, how can you do a tummy tuck without drains? Like, how do you do it? And, what I essentially just described is that, you remove that fanny pack, that extra skin and fat. There's space that's there, but as you close and the abdomen, you're closing it in multiple layers. And if you can obliterate that space, so there's no empty space that's there by sewing the top portion of the belly, that skin and fat that's below there, to the bottom and to the abdominal wall, you're really getting rid of any space that's potentially there, so that the fluid can't really even build up if it wanted to. And I just inform them that our bodies are attuned with that. We have kidneys, we have filters that they flush it out. And if our body, for whatever fluid we have, it can maintain and control that, then it's not going to leak through the skin. And so I've not had any wound breakdowns. There has been here and there a couple of aspirations where you take a little bit of fluid off just for pressure. But I would say that that's extremely uncommon, but that's something that I inform patients about before surgery for a Drainless tummy tuck.
Right.
And so it's been awesome.
I would like to say, drains are obviously bad. I think obviously the end result's the most important thing. There's a lot of great surgeons that still use drains and want to look at the result, make sure that it's not just choosing it for the Drainless, but in our practices, it's been really, I think, beneficial for the patients. which is the big thing, and less and fewer seromas and issues, and then the drains, these little drain sites that kind of get irritated. So yeah, they're not fun. No one likes them.
And before my loyal patients just blow up my Instagram saying, "Why did I have a drain?" I will say that there are some situations where I still use it.
Right.
So there are still some, indications for me. Recently I had somebody who lost over 100 pounds, ended up doing, and I would say whether I'm doing a torsoplasty or an incision all the way around 360 degrees around the back and belly, or doing what's called a fleur-de-lis. So you have a transverse or side-to-side incision as well as an up and down incision going up the belly where the belly button is. Although I place internal sutures, which is what helps us obliterate that space and the opportunity to do a drainless, I still oftentimes place a drain that's there just because I don't feel that I can completely eliminate all of the fluid buildup that's there, or all the space that's there, or I'm using a higher volume of tumescent fluid where I feel like there's just a lot of fluid left behind, and I'm usually taking it out at the first visit, and it may or may not have put out very much fluid, but to me, I'd rather have that than worry about any potential healing or issues. So I'm not married to it till death do our part, but I definitely utilize it as much as I can. I don't know if you have any thoughts about drains for those types of procedures.
Yeah, I tell everyone that there's always a chance I might put one in if some people just have a little bit more fluid around that I maybe don't like. It's probably less than 1% for a standard tummy. Well, standard tummy, it's probably less, than probably zero essentially. But yeah, the bigger massive weight loss, torsoplasties, fleur-de-lis. I think a lot of us do it. You can only have so much skin. There's a lot of laxity kind of in the upper back area. There's still stuff moving around. There's more friction. In those situations, I think they can still be helpful to really just minimize any chance of issues.
I've partnered with some local lymphatic massage therapists too. I'm not sure what your thoughts are on that. To me, it's not required where I'm mandating that they do that, but because it's become so commonly asked of me, I do have resources to go. And I would say, hey, if you're concerned about that or concerned about fluid and you want to maximize everything that you can do for your body, a lymphatic massage can be helpful, and just see where they go. I would say it's kind of a flip of a coin. I would say 50-50 or maybe a little bit higher percent actually follow through with the lymphatic massage, but that's something I'm discussing too pre-op.
Yeah, a lot of patients are asking about it, and I'm kind of, some sort of thing was, I also encourage everyone to do it. I'm kind of more of a, maybe things look a little bit better a little earlier, but long-term probably doesn't change results too much. For some really big LIFO cases, especially if you're using Renuvian, sometimes I will encourage it. Sometimes they tend to retain fluid a little bit more inflammation. But tummy tucks, I really don't want them pushing on things for at least the first, 7 to 10 days. I don't want them doing anything in that period to tell them.
Yeah, it usually starts 2 to 3 weeks out if they're going to do that. And I would say that the patient.
Some people with drains, though, they started right away to kind of try to push it into the drains. I don't want that without the drains.
I don't want that either. Yeah, to me, it's like a couple weeks later. And really what I mentioned before, 3 to 8 weeks is when there's peak swelling and healing afterwards. Yeah. So it's really when you're getting into that 2 to 3 week mark where the tissues are just getting dense and heavier. I've just had a lot of feedback positively from patients who said that was great. I felt much.
Some people love it. Yeah. I think it could help. It's just there's kind of variable data. So it's not everyone needs it. Have you had patients describe functional benefits from the tummy tucks besides things just looking better?
Yeah. And so, as part of my consultation with them, I just let them know that, lower back pain can improve, is not a guarantee. But anytime that you're improving your core strength, your ability to do planks, to do abdominal exercises, just to have that core there that was gone is huge. And some patients actually feel like some GU issues actually improve afterwards. So there's tons of functional benefits. I've had several patients who are fitness fanatics and just feel like they have no central core strength from C-sections, from pregnancies, and have that skin redundancy, so it's removed as well. But there is singing praises as far as how well they can work out and lift and feel strength, and other patients with urinary issues have improved just because of the bladder pressures and the intra-abdominal pressure you're restored, because you can actually bear against the contents that are within you. And I'm certainly not offering magic pixie dust or snake oil, but these are proven improvements. How do you go about discussing these possibilities with patients?
Yeah, and I think it's probably an under-discussed benefit in a lot of ways. So I think it's important to be aware. Every patient during the consult, I talk about it. On the exam, I feel for their muscle separation, and like you said, it's not. If you have a true structural issue with them, compressed nerve or something like that, it's not going to fix that. But having those core muscles disrupted, that weakens the lower back, the pressure issues like you mentioned. Yeah, I've had patients with chronic constipation issues that basically fix, hip pain, all sorts of stuff. It's pretty incredible besides just what we normally talk about, lower back pain and urinary incontinence. So it's very powerful surgery in multiple kind of ways.
So Dr. Butz, that means my tummy tuck will be covered under my insurance then?
Insurance will not cover your tummy tuck.
What additional procedures do you like doing at the same time as a tummy tuck, and maybe one or two that you him and haw or don't feel is a good combo procedure?
We routinely combine, what we call 360 lipo or circumferential lipo to, like you mentioned, with just a standard tummy tuck, we often do liposuction of the flanks or kind of sides. And I do some centrally for contouring. So 360 circumferential, we kind of address the upper and lower back as well, if we kind of sculpture the entire torso. So that's a common thing we add. And then obviously breast surgeries, breast lifts, reductions, ogpexies are very easy, and kind of, then you bulk in one recovery for all this instead of two recoveries, and can be very safely done in less than 5 hours typically. I don't like doing thigh lifts with tummy tucks. I think they're kind of pulling on each other a little bit. But that's probably the one thing I don't really like to do with it.
Yeah, I would say the combo breast surgery and tummy tuck is a home run. I always say that the recovery is essentially the same. You don't want to have FOMO or fear of missing out, where you're looking at your nice tight belly and then you're kind of wishing the top matched the bottom. And so to me, that's a pretty easy decision. Doing anything anywhere else, I think it just makes it harder. So yeah, I agree. Thigh-plasties to me is kind of is a standalone procedure done, with other adjuncts. One thing that I think is trendy that you and I both do is fat transfer. And so while I'm not doing super high volume Brazilian butt lifts, if there is a hip dip or if there's an indentation on the lateral butt area, thigh area that looks unpleasing or is problematic for the patients, if we're doing liposuction, we're taking the fat out. Sometimes the patients are asking, or sometimes I'm bringing it up during the exam, like, hey, I'm seeing this is what it looks like in some patients. It doesn't bother them. Other patients are like, oh wow, you can fill that in, that would be amazing. So I don't want to counteract the ability that you need to lay on her back after a tummy tuck in rehab by injecting a bunch of fat on their butt. But if there's a little bit of fat that can be transferred and placed into the lateral area, that's not going to be overly compressed with the post-op protocols and requirements after a tummy tuck, to me, that's just another, and I think a trendier or a more common procedure being done.
Yeah, I think like you're saying, smaller volumes and more lateral, I think is key. So yeah, you don't want to do a traditional BBL and you can't really sit on it. So my focus in tummy tuck is make sure that heals properly. We don't want to be, compromising things with that. That's absolutely a nice little add-on as well. Cool. That's a lot of great tummy tuck stuff. What else? Any other quick thoughts? Future topics?
What topic you want to talk about next week?
I don't know. We have a list.
You
want to talk about hands? You do a lot of hand surgery.
We can do hand, but I feel like you're just going to be a spectator. Do you want to?
I remember some of that stuff. I can.
Yeah. You want me to put you on a hot seat and just quiz you?
Oh no, don't do that.
Sure. Do you want to jump back to how about breast lift and breast, augmentation?
You need the breast lift.
Yeah, and I think, we can kind of talk a little bit more about internal bras during that podcast as well, as far as breast lifts with and without augmentation. I think that's a huge topic, because oftentimes patients are coming in wanting just an augmentation and not realizing that they need a lift to achieve their goals. Or some patients are equally satisfied and happy by being able to just pull things tighter, get them as a reset against gravity as we get the girls back to where they're supposed to be, and we can even avoid the implant altogether. So I think that's a great topic, and I can hit home with. So we'll leave
Awesome.
it at that.
Well, great chatting again. We'll see you soon.
All right, buddy. Take it easy.
All right.
Thanks so much for tuning into this week's episode of Fuller Butts, a behind-the-scenes plastic surgery podcast. Doctors Fuller and Butts are so appreciative of your time and attention. We invite you to subscribe, share, and continue to enjoy our plastic surgery perspective. Feel free to reach out on Instagram at either @FullerSurgeryMD or @DanielButtsMD. That's Butts with a Z, for comments, suggestions, and support. Remember, be artsy, stay scientific, and make life fun. We hope you'll join us again on the next episode of Fuller Butts.